and it is my honor to welcome all of you to the 2023 Global Hepatitis Resource Mobilization Conference, hosted by the Arab Republic of Egypt and the Kingdom of Saudi Arabia, alongside CHAI and the Hepatitis Fund. Thank you all for joining us as we work to make history by raising funds to accelerate hepatitis elimination in low and middle income countries. There is no reason that another child should contract hepatitis B at birth, and there is no reason that any person should die from hepatitis B or hepatitis C infection.
Let us seize this opportunity to contribute to the cause, sharing knowledge, exchange best practices, and foster innovation to overcome the remaining challenges.
The Egyptian government has the pleasure of participating in this important meeting as a key partner and would like to thank you all and thank the Hepatitis Fund for convening the Resources Mobilization Conference in recognition of the global public health threat.
It's a most preventable and treatable disease with vaccines and medicines that can be delivered at the primary health care level. Elimination is possible, but too many countries lack the resources to invest in the tools they need to achieve it.
أكثر من 1,000,000 شخص يموتون من آثار هذا الوباء سنوياً، وهو أكثر من مجموع أعداد الوفيات الناجمة عن فيروس نقص المناعة والسل والملاريا. هي أرقام صادمة.
It's the first time we call all of you, all the important partners, international organization, local organization, country and industry together to come in a room to discuss the financial gap to fund the elimination of viral hepatitis.
The commodities that you need to diagnose, to prevent, and to treat viral hepatitis are actually very low cost. So most of them are being produced by generics. There's also this low cost programs. So the real challenge now is getting governments to act, getting governments to mobilize, and in many cases that does require the resources that are challenging. But yes, the innovation is there. It's at affordable prices. We just need to mobilize and take advantage of it.
Vous êtes ici chez vous. La Genève internationale a besoin de vous. Nous avons besoin de vaincre l'hépatite. Telle est la mission cruciale de santé publique dont est investi the Hepatitis Fund et pour laquelle le Conseil d'État que je représente soutient les activités.
Ending hepatitis is not just an aspiration, it is achievable. The rollout of antiretroviral drugs has shown us that what was considered utopia has become an achievable global target. What AIDS has shown us is what can be achieved when the world comes together to fight a major pandemic, when the right to health is aggressively addressed, and when we see medicine and health care as a global public good, and when we see prevailing inequities and resolve to act.
Let me say that again. For 1 year's HIV spending, we could eliminate hepatitis C in 70 countries in the world. We have the ability to foster a generation free of hepatitis B. We don't have to build any new health systems to deliver that care. It's time to get it done. We have the will. Let's add resolve and resource today.
We have strong community members on the ground ready to help. We have case studies of successful interventions that are being done in different countries. So this is a sustainable development goal that we can achieve, and yet we are far from where we should be right now.
We, of all people, want the achievement of viral hepatitis elimination, but it will not happen with the current medical recommendations and the many, many barriers we face. The gaps in diagnosis, care, and treatment are too great.
Let's end hepatitis till 2030. Let's do it together.
So we need these demonstration projects, we need the funding to really support these catalytic investments. Hepatitis B and C elimination is cost-saving or highly cost-effective. The one takeaway I want you to have is these are incredibly cost-effective interventions. Because of fragmented health systems, most countries don't actually realize that they're already spending a lot of funding on hepatitis elimination.
Again, it's a privilege to be a part of this and making this commitment from our side to provide the hepatitis C treatment, sofosbuvir, daclofenacin, the product at an affordable price of $60 for treatment, and tenofovir for hepatitis B at $2.4 per pack of 30s, which translates to about less than $29 per patient per year.
I'm glad to pledge our commitment to make the treatment WHO pre-qualified sofosbuvir daclofenacin treatment at ex-works price of $60 per treatment, and as well Hep B treatment tenofovir 300 mg US FDA approved product at ex-works price of $2.40.
Thanks for the companies who are committed to decrease the prices to very affordable prices. I think this is going to make a huge difference in implementing strategies in countries. There are some very promising programs who just need a little push to reach the last mile.
A few low and middle income countries are on the road to eliminating viral hepatitis and are really the true champions. Countries like Brazil, Egypt, Georgia, Mongolia, and Rwanda are furthest ahead, and other countries including Cambodia, Ethiopia, India, Nigeria, Pakistan, Uganda, amongst many others, are committed to elimination and are making big strides in their programs.
Nasarawa State is an excellent example of how at the subnational level, political leadership and commitment can make a difference. And so it's been an excellent example for us that we share with other states.
Wouldn't we all be very proud if we could say as a collective we've been able to achieve that SDG?
Honestly, I think the Hepatitis Fund is going to be a really, really vital vehicle for us to achieve many of these shared goals, but also to unlock the potential of global fund investment.
So in addition to the seed funding that we provided 3 years ago, so the Sun Foundation has pledged to donate another $2 million.
Political will starts at meetings like this, where different groups come together that haven't been together in the past, and that includes civil society, governments, NGOs, implementing agencies, funding agencies, industry, and technical expertise need to work together, and often we don't. And what I've heard today shows me that we're already coming together to really make this a reality, because it's not a cost issue anymore, and it's not a feasibility issue. It's a resource mobilization issue, as Siobhan said, and that ultimately ends up being about political will, and we're the group that needs to drive that, right? It's on us to generate that political will by working together on an aligned agenda, and what I've heard today makes me feel like we're doing it, and that's really exciting.